Afternoon, and welcome to this edition of Disability Chat. In this session, Allison Bartlett, HDSA's resident disability expert, will talk about navigating health insurance, including Medicare, Medicaid, and private insurance. You can send a question at any time during her presentation. Just click on the chat function in the toolbar, type your question, and press send. Your questions will be answered at the end of the session. This presentation will be available in about a week on HDSA's YouTube channel. We also like to invite you to complete a survey on HDSA's disability program and its effectiveness in helping families navigate the disability process. If you are viewing this webinar live, a link will be sent to you for this survey immediately after the broadcast. However, if you're watching the recorded version, there is a website you can go to at www.surveymonkey.com. Allison will have a slide with this link as part of her presentation at the very end, so you can see it at that point. And now a little about Allison. She is HDSA's Manager of Disability Programs and is a disability attorney who specializes in representing clients with rare chronic conditions like Huntington's disease to navigate through the complex disability system. Allison holds a JD from the University of Cincinnati College of Law. And now I'll turn our chat over to Allison.
Thank you, Deb, and thank you everyone for joining me today to talk about this really important topic. This is also very timely because hopefully everyone here has health insurance, but the health insurance marketplace is open until the 15th, so the end of this week. So there are things that you could learn today that could help you get health insurance for the upcoming year. So what are we going to talk about today? I'm going to review the different types of health insurance, what to consider specifically for HD care, what to look for when getting health insurance, what to look for when choosing a plan, options when you stop working, and what to do if you cannot afford insurance. So the main different types of health insurance, there's the health insurance marketplace. So essentially that's private insurance. There's also employer health insurance. This is also private health insurance. There's Medicare and Medicaid. But when people think about health insurance, they think about these four main categories. So what is the health insurance marketplace? The marketplace is designed to help people shop and enroll in health insurance. It's just an easy way for people to look at all of the different plans that exist. Who is it for? It's for anyone who needs insurance and is not eligible to get it through an employer or Medicare. It can help people get Medicaid if they are Medicaid eligible. Who gets coverage? It is for individuals and families. Is there financial assistance? There are premium tax credits and other savings options to help cover costs of monthly premiums. But just as a reminder, health insurance through the health insurance marketplace, it's not specifically designed for individuals who need financial assistance or low-income individuals. The health insurance marketplace is for everybody. You may be able to get financial assistance if you're low income, but it covers a wide range of people who can afford the most expensive health insurance. And is it government or private insurance? And like I said, this is private insurance. So employer health insurance, what is that, or who is it for? It's for all eligible employees. Who can get coverage? Employees and generally their families. There are exceptions. Some companies will not cover a spouse if the spouse has provided coverage from their own employer. So I am married in this circumstance because I'm offered health insurance through my employer. My husband's employer will not cover my health insurance. And so that definitely happens. So that's something to look for when you get married or when you're signing up for health insurance. Is there financial assistance? Yes, employers often pay a large percentage of the health insurance premium. Most employees get their health insurance at a greatly reduced cost compared to what it actually costs their company. And is it government or private insurance? It's always private insurance. Medicare. Who is it for? It's for people over the age of 65. So if you're over 65, generally you're automatically enrolled in Medicare. It's also for disabled individuals receiving SSDI. Who can get coverage? It's only for the individual who meets the eligibility criteria. Families and spouses are not eligible, so this is only for a single person. Is there financial assistance? Yes, based on your income. And is this government or private insurance? This is government insurance. It is a federal program. And Medicaid. Who is this for? It's for low-income families, children, disabled individuals, and there's no age limits for this, unlike Medicare. Who can get coverage? This is for individuals and families. Is there financial assistance? Yes, the whole program is essentially designed to be financial assistance because it is for low-income individuals. And is this government or private insurance? This is also government insurance, but this is a state-run program versus Medicare, which is a federally run program. So now that we've talked about the four main insurance types, what are things to consider for HD care? So when you have HD, there are 5 main things to really look for. You want to consider your specialists, what kinds of therapy you're receiving, if any, medical testing, medication, and assistive devices. It's important to think about all of these things because you're not going to need them all at once. Things to remember when you're looking for health insurance, and this is just in general across the board for everyone. You can change your insurance plan to fit your needs. You get to review your insurance every year. You re-sign up every year. So that means that you get to review your coverage and you have the option to choose new coverage every year. So you can get more coverage if you know some big event's going to happen in your life, or you can get less coverage. I personally just had a baby this year. So I know the last few years when I was looking at coverage, I had to make sure my health insurance was going to cover those things. I didn't have to make sure that was going to happen for next year. So kind of thinking about it a year at a time. Don't assume that you sign up for health insurance once and you don't really need to change it ever again. You don't want to do that because then you might not be covering all the things you need, or you might be paying for more than what you actually need. Focus on your needs for this year. You do not need to purchase coverage for things you do not need at this time. It is not a good use of your money, your funds. So for HD, it is really important to consider specialists, especially a neurologist and things like psychiatrists. HD care requires care from a specialist, and you want to make sure your specialist will be covered by your health insurance. From a medical care perspective, it is easier to find any primary care physician or PCP than it is to find a specialist. And I'm mentioning this because if you can only afford so much health insurance, it's better to get a health insurance that covers a specialist than it is to cover your primary care physician. There are circumstances where you might be able to get a variance, or you can have one of your doctors submit something to see if they can get an exception and your insurance will now cover that provider, but that doesn't always happen. It's also good to recognize that only a handful of neurologists actually specialize in the care and treatment of HD, which is why it's so much more important. Like if you're at the point where you're going to your neurologist regularly and you need to see them every 6 months to a year, that your neurologist is covered by your health insurance, because you want to make sure that that's paid for. You also want to consider therapy. And when I say therapy, it's not like talk therapy, that's important too, but it's also physical therapy, occupational therapy, and speech therapy. So that's like a psychologist or a psychiatrist. And these are important things that are covered because these are things that come up a lot with HD care. Physical and other therapy can be very important tools for HD care, but it can be expensive. Physical and occupational therapy especially are also good because they can help delay the onset of symptoms, or they can help make it easier for someone to continue to live their life on their own as much as possible. Most health insurers do cover a portion of the cost of therapy. Medicare and Medicaid cover the biggest portion of the cost. Private insurers, it can be really hit or miss what they cover. So if you know you are going to need therapy, that is something you should be looking out for. You may have to pay a deductible or copayment, which is pretty standard, and that can be anywhere from $15 to $50 per session. It's important to know what the deductible or copayment is though, because if you're going to therapy 3 times a week and you're paying $50 a session, that adds up really quickly. Before purchasing insurance for the year, it's also good to think about things like medical testing. And the reason I say this is because with HD, medical testing is not really a regular occurrence, or not the really expensive stuff. So really expensive medical testing that doesn't happen very often is neuropsychiatric testing. Sometimes it's the gene testing, but these things don't happen very often. These maybe happen like once for gene testing, or once every 3 to 5 years for neuropsychiatric testing. So you don't necessarily have to have health insurance that covers those things at all times. When to start thinking about this is if you start noticing symptoms and it start impacting your ability to work. Not necessarily a lot, but if you're getting to the point where you're like, oh, okay, I either need accommodations at work, or I need to start thinking that disability might be down the road in a year or two. That's a good time to get neuropsychiatric testing because that can really help a disability application. You pay a little bit more for insurance that year, you get that done, then you don't have to pay such expensive premiums the year after. But this is something to also consider when looking at health insurance. And then lastly, you want to consider medications. HD medications, like HD specific medications like Xenazine and Austedo, can be really expensive. And so that's something to look at when looking at health insurance. And if you're at the point where you've just tested positive and you don't need medication, you don't have to make sure your health insurance covers the expensive medication at this time. You don't want to pay for something that you're not going to use, because then essentially you're just throwing money away. It's not like paying for your mortgage. You're not getting any investment back when you're paying your health insurance premium and there's a lot of stuff you're not using. You're just kind of throwing the money away, and I don't want anybody to do that. Also look at any other medications you're taking. There's a whole host of things that people are prescribed, but it's important that your Medicaid, like if you're on a regular medication, you want to make sure that it's covered. And just so you know, drug companies sometimes do have assistance programs. A lot of people need assistance these days, so it can be really competitive to get assistance from the assistance program, and you don't want to have to rely on that. So now that we've kind of talked about what specifically to look for with HD, what's some general information and what do you need to look for when choosing a health insurance plan in general? So the big things are costs, categories, which we'll talk about, plan and network types, and then of course, coverage of current doctors and coverage of current medications. So health insurance costs. When most people think about health insurance costs, they think of the monthly premium. That's the biggest thing. That's usually the thing that you pay the most for, but that's just one component of looking at health insurance. You don't just want to buy a policy based on the monthly premium. You also want to look at out-of-pocket costs, which includes things like copays and your deductible. And deductibles are how much you pay out of pocket before insurance picks up the tab. You don't want to get fooled by a low monthly premium that has high out-of-pocket costs. And that happens a lot. So I haven't been on the health insurance marketplace exchange in a while, unfortunately. But let's say the cheapest health insurance premium that you find is like $200 a month, but then you have a $10,000 deductible. That means you're going to have to spend $10,000 before your insurance picks up the larger portion of any of your healthcare costs. That's a lot of money. And so you have to really look at monthly premium versus out-of-pocket costs based on how much medical care that you need. And I'll talk about that a little bit more later. So I was saying health insurance categories. So what these categories are the 4 metal categories. So bronze, silver, gold, and platinum. And I'm sure we're all very familiar with these days. And these categories show how you and your plan share cost. It's not a reflection of the quality of care you will get from the health insurance plan, but it has everything to do with cost. There are also catastrophic plans available to certain people, and I'll talk about that after I go over the 4 metal categories. But this chart is just an overview. So if you have a bronze plan, the insurance company pays 60% of costs and you pay 40% of costs. A silver plan, you pay 30% of costs and the insurance company pays 70% of costs. So you see the higher the plan gets, the more the insurance company pays, which is why insurance premiums get so much more expensive the higher the plan category. So the bronze plan. These have the lowest monthly premiums, but they have the highest cost of care when you need care. So generally bronze plans deductibles can be thousands of dollars a year. Usually deductibles for bronze plans start around $6,000 a year. It's a good choice if you want a low-cost way to protect yourself from worst-case medical scenarios like serious sickness or injury. Your monthly premium will be low, but you'll have to pay for most routine care for yourself. So these plans are good if you don't really get sick a lot, you're not using your health insurance very often. Silver plans. So this is a moderate monthly premium. And it's moderate cost when you need care. Silver deductibles are usually lower than those of bronze plans, It is important to know that if you qualify for cost sharing reductions through the healthcare marketplace, you must pick a silver plan to get the extra savings. You can save hundreds or even thousands of dollars per year if you use a lot of care. It's a good choice if you qualify for extra savings. It's also good if you're willing to pay a slightly higher monthly premium to have more of your routine care covered. And as we go through these medical categories, what really becomes apparent is the more care you need, the more you benefit from paying into a more expensive health insurance plan, which I know isn't like that's not possible for everybody, but that's kind of the way this is set up. And so it's just information for you to have. With a gold plan, it has a high monthly premium, but there are low costs when you need care. The deductibles are low. It's a good choice if you're willing to pay more each month to have more costs covered when you get medical treatment. If you use a lot of care, a gold plan can be a good value. And then platinum plan, the highest level, has the highest monthly premium, the lowest cost when you get care. And it's usually, this is really designed for people who usually have a lot of care and are willing to pay a high monthly premium, knowing nearly all costs will be covered. And what kind of can make it tricky for HD sometimes is while care can be expensive, it doesn't necessarily mean you need a lot of it. If you're pre-symptomatic or very early symptomatic, you may not need a lot of care. You may still only be going to the neurologist every 6 months, 6 to 12 months. And if you're not on medication, you're not having any other therapy or anything like that, you don't necessarily need an expensive plan at that point. But as things start to change, that's when it's good to start to review what's covered by your health insurance and how you want to spend your money. Outside of the medical categories, there's also the catastrophic plan. You are only eligible for this if you're under the age of 30 or you're of any age, but you have hardship or you meet the hardship or affordability exemption. There is additional paperwork you'd have to complete. You would have to complete the hardship exemption form, which you can find at this link. And certain hardship exemptions include homelessness, evicted or facing eviction, receive a shutoff notice from a utility company, experience death of a family member, experience domestic violence, had medical expenses that you could not pay, or you're ineligible for Medicaid because your state has an expanded Medicaid. And there are still, I think, like 10 to 15 states that have an expanded Medicaid. So it's important for families to be aware of this option. There are probably families who could be on a catastrophic plan and aren't aware of it. So now you know. And a catastrophic plan is a good choice. Like has the lowest monthly premium. It has high costs when you get care because the deductibles are very high, but it's a good choice if it's an affordable way to protect yourself from worst case scenarios like getting seriously sick or injured. It has to cover the same essential health benefits as other marketplace plans. It does cover certain preventative care at no cost, and they cover at least 3 primary care visits per year before you've met your deductible. So it does provide care. So this is kind of if you have no other options, or again, if you don't go to the doctor very often, it's better to have this than nothing. We also will talk about later what happens if you don't have insurance at all. Now I'm going to talk about plan and network types. To be completely honest, I had no idea what these different plan and network types until I looked it up for this presentation. So I'm learning things too. But this is something that comes up a lot. People see like the HMO, the PPO, the EPO, the POS, and they're like, I don't really know what this means. That's why we're going over it today. So HMO is Health Maintenance Organization. PPO is Preferred Provider Organization. EPO, Exclusive Provider Organization. POS, Point of Service Plan. Those words don't mean a lot, but these plan types matter because it's the difference between you choosing your own doctors and specialists or having your doctor decide what specialists you see. So it is important to note the difference. Here is a very handy chart to know the difference. So HMO and point of service plans, so the ones at the top and the bottom, Those typically require a referral before you can get a procedure scheduled or before you can see a specialist. So if you don't mind having a doctor or your insurance tell you who you can see, those are better plans. And the reason that is an option is because they're generally lower out-of-pocket costs. And it can be beneficial if you'd like to have your primary doctor who can coordinate care for you if you have a good relationship with your PCP and you trust them. If you want to have more control over who you see, then it's better to have a PPO or an EPO plan. There are more provider options, no referrals are required. There may be higher out-of-pocket costs, but you have more control over your care. Really, for HD purposes, it's probably better if you have a PPO or an EPO because there are so few HD specialists in the country. You want to be able to say, I need to go see this specialist because they treat my exact disease. You don't want to have to wait on a referral from your PCP who may not get it before you can get care that you need. It is important to know when you can and can't get in and out of network care. Always out of network care is more expensive, but for certain health insurance plan types, you can't, like, you will have to pay everything if you go see someone out of network. So for HMO and the EPO, you have to stay in network for your health insurance to cover any of the appointment or the visit. For the PPO and the POS plans, you can get care out of network. It's less expensive, so your health insurance will still cover a portion of it. So those are just kind of things to consider. Again, having this chart will be really handy when you are looking for insurance. So really the main difference, as I talked about, HMO and POS require a visit to your PCP before a procedure or a specialist visit can be scheduled, but they do tend to be the cheapest health plans. And PPO and EPO, they allow you to choose your own specialist. Again, they're better for HD care, but they're more expensive. So this is a really easy way to kind of look at these things and figure out what's more important to you. Do you need something that's a little more affordable, but you get less say, or do you want to make sure you have complete say of what doctors you can see? So what kind of plan is right for you? And that's ultimately up to you, but some things to consider for plan choice. A plan that pays a higher portion of your medical costs, but has higher monthly premiums might be better if you see a primary physician or a specialist frequently, you frequently need emergency care, you take expensive or brand name medications regularly, you are expecting a baby, plan to have a baby, or have small children, you have a planned surgery coming up, or you've been diagnosed with a chronic condition such as diabetes, cancer, or Huntington's disease. A plan with higher out-of-pocket costs and lower monthly premiums might be better if you can't afford the higher monthly premiums for a plan with lower out-of-pocket costs, or you're in relatively good health and rarely see a doctor. And again, what's really important here is it's okay to have a plan with higher out-of-pocket costs and a lower monthly premium earlier on in the disease process and the progression, and then switch. That's why it's really important to always review this every year because things are constantly changing. Don't just continue to sign up for the same insurance just because you've had it. Make sure to take all of these things into consideration so you're getting the most bang for your buck. It's also important when talking about health insurance to talk about a health savings account. Health savings accounts are available to people who have purchased a high deductible health insurance plan. So that's somebody generally who has like a bronze or silver level insurance. A savings account, this is a savings account that lets you set aside money on pre-tax basis to pay for qualified medical expenses, which can be really helpful. If you have a high deductible health insurance plan, you can contribute up to $3,650 for self-only coverage and up to $7,300 for family coverage. And what's nice is a lot of times if you're eligible for an HSA account, your company will also contribute money to it as well. So that's something to consider. So for a lot of companies, one thing that they offer, if you have to get a high deductible plan, they also let you have an HSA account and you don't have to contribute the full amount because your company might contribute half or something like that. So if you are eligible to open an HSA account, it's really important to look into that, because if you have access to it and your company is going to contribute, take the free money. Please take the free money, because you can use your HSA account to pay for a lot of things. You can, it covers medications, doctor's visits. It covers things like hearing aids, glasses, contacts. It covers a lot of stuff. So if you have that option available, take it. HSA funds roll over year to year if you don't spend them. And an HSA may earn interest or other earnings, which are not taxable, but it means if, let's say you've been paying into your HSA for 5 years, you haven't touched it, it is growing slowly. And so it's always nice to have that backup money there, because you never know when you're going to need it. So now that we've talked about what to look for when purchasing health insurance, what happens when you stop working? And this is really important, because with HD, unfortunately, there is a very good chance that you're going to stop working. It's also important to note that if you have HD, it's really important to get medical care. So losing health insurance can be really, really scary. So for a lot of people get health insurance through their employer. If you have to stop working because of your HD, you're likely going to lose your health insurance because you have to stop working. Well, if you're approved for Social Security disability, there's still a 2-year waiting period before you're enrolled in Medicare. So there's definitely a time where you may not be covered. To note, with the 2-year waiting period for Medicare, the waiting period starts from the date you submit your application, not the date you get your award letter. So generally, most people are not waiting actually the 24 months, but they're still waiting up to 18 months. You could still wait anywhere from like 6 to 18 months, which is a long time to go without health insurance coverage. So what are your options? First, if you know you have to stop working because of your disability, you are eligible for COBRA if your employer has 20 or more employees. You will have the option for COBRA. So what COBRA is you can continue to pay for your employer provided health insurance. The downside is you will now have to cover the full cost of the premium, which can be anywhere from an additional like $2,000 to $1,000 a month. It means that you won't lose coverage. You won't have any gap in coverage, but it can be really expensive. There is a time limit. Generally, COBRA lasts up to 18 months. You can get an 11-month extension if you are found disabled by Social Security. And what this means is it means your full Medicare waiting period is covered. So you never lose health insurance coverage. And that's really nice. Spouses and children are eligible as well. So if you are the one who's providing health insurance for your entire family, if you pay for COBRA, you will continue to get health insurance for yourself and your entire family until that waiting period is over. The one thing that would be bad at that point, once you're enrolled in Medicare, your spouse and your children will then have to find different health insurance. And you have 60 days to take or decline the coverage. So as a quick summary, the pros of COBRA, it's continuation of insurance coverage, no change to providers or medication, and spouses and children are eligible. The cons, it's expensive. You will pay a higher premium, and in a lot of cases, it's a much higher premium. Not all employer group plans offer COBRA, and you can only stay on COBRA for 18 to 36 months. And the 36 months is really only for spouses and children, if the person who had the health insurance passed away or got divorced or something like that. But generally, as an individual, the most amount of time you can stay on COBRA is 29 months. So another option when you stop working is you can get insurance through the marketplace. So loss of health insurance coverage is considered a qualifying life event, which means you would be eligible for a special enrollment period. You cannot wait to sign up for coverage because at most you have 60 days to enroll in a new plan. And coverage will not start until you pay your first premium. So let's say you stop working and you're not sure what kind of health insurance you want to get, what you want to go about, and you finally sign up for health insurance on day 59. It means you are not covered for health insurance for at least 2 months. Because let's say day 59 of your 60-day period is today. January 11th, your health insurance won't start until February 1st. So then that means you will have almost 3 months with no health insurance coverage. Hopefully nothing happens in that time. You can never be sure, but it means there's going to be time without health insurance coverage. And one nice thing about the health insurance marketplace is technically you will have more affordable options because you will get to determine what your premium is. If you take COBRA, you have no say in what your premium is. It's just what your company tells you that you're going to have to start paying. So pros and cons of marketplace insurance. Pros, it is more affordable because again, you get to pick what plan you can afford. There's flexibility in choosing a plan and there's no mandatory end date. You can stay on this marketplace insurance for as long as possible until Medicare starts, whatever. Cons, you will have a gap in healthcare coverage. While this can be stressful, it's not always a huge deal, but it's just to be aware that you will have a gap in healthcare coverage. You don't want to be like, oh, I'm in perfect health, and then you have a random emergency room visit out of nowhere during that gap in healthcare coverage, because then you might have to pay thousands of dollars out of pocket. Insurance may not be as good as your employer insurance, and you only have 60 days to enroll, so you do have to decide. If the special enrollment period lapses and you have not made a decision, you cannot get health insurance until the marketplace opens in November. You do not want that to be the case. And then as a third option for what happens when you stop working, you may be eligible for Medicaid. Again, loss of health coverage is a qualifying life event and would make you eligible for the special enrollment period. This is technically the most affordable option, but you have to meet the very strict financial criteria based on your monthly income and resources to be eligible for Medicaid. So what that means generally is you have to be at less than 133% of federal poverty level, and you have to have less than $7,000 in resources. So if this is like if your family was, low middle income or low income to begin with, and then you lose your job and your health insurance, then you may be Medicaid eligible at that point. But this is not going to be an option for a lot of people, but I want to make you aware that it is an option exists in case you fall into this category. Another thing to be aware of is that not all states have expanded Medicaid. And in those states, you will not be eligible for Medicaid unless you are deemed disabled by Social Security. In this case, if you live in a state where Medicaid has not been expanded, so that's Kansas, North Carolina, South Carolina, Georgia, Florida, Alabama, Mississippi, Texas, places like that, you may be eligible for catastrophic health insurance instead. If financially you would meet the criteria for Medicaid, but you cannot get Medicaid because you have not yet been found disabled. So pros of Medicaid. It's the most affordable insurance plan. You can continue Medicaid even after Medicare enrollment. So let's say you're found disabled for Social Security Disability Insurance, SSDI, and you're enrolled in Medicare after 2 years. Depending on how much you could get both Medicare and Medicaid at the same time. And Medicaid covers long-term care, which is great for HD families. Cons, most people are not eligible due to financial restrictions. Not all states have expanded Medicaid. And again, you only have 60 days to enroll. So the last technically the last option you have when you stop working is you just don't have any insurance at all. Honestly, this is not really a good option. And the reason for this is one, you want to make sure you have health insurance because especially with a chronic condition like HD, you never know when you may need care. You never know when someone might fall and have to go to the emergency room. You just never know what's going to happen. The other thing is, in order to be found disabled, you need medical evidence, which means you have to have continuing medical care. Those are necessary to get disability. And a finding of disability is necessary to get Medicare. A finding of disability is also necessary to get health insurance if you have a private program. So let's say you work for the state, and so you don't pay into Social Security, you pay into a private state disability program. You also have to have medical evidence to show you're disabled to get health insurance through that program. So ironically, you have to have health insurance to get medical care to be found disabled to continue to get health insurance. Or as this chart sums up. So if you have no insurance, you cannot get medical care. If you can't get medical care, you can't get medical evidence. If you have no medical evidence, your disability is going to be denied. And I know that can be really scary. Again, I'm always going to stress the importance of getting medical care, not just to help make sure you have the best quality of life and you get the care that you need, but also to make sure you have medical evidence when you do ultimately need to file for disability. There are options. What to do if you cannot afford health insurance. There are free or low-cost healthcare providers. There are a lot of health centers that provide care on a sliding fee scale. So they will only have you pay what you can afford. This link is really great. If you go here. You can enter your location and how many your mile radius, and you're from 5 to 250 miles, and it'll tell you what health centers are located in your area that provide low cost or free healthcare providers, and that will allow a sliding scale. It's also really important to know that you can get financial assistance. Most major hospitals and healthcare systems have financial assistance programs. What that means is you can get discounts for self-pay patients. There's indigent care programs. So if you are low income, there are care programs. A lot of these systems also have financial counselors to help walk you through the process and see what will be best for you. This is really important because I'm not going to say all, because we should never speak in all, like always or never, but most, if not all, of HDSA's centers of excellence fall into this major hospital system or healthcare system umbrella. That means you are going to have a financial assistance program at your center of excellence. So Columbia University Health System, that's a major health system. They're going to have a financial assistance program. Wexner Medical Center at the Ohio State University Healthcare System, they're going to have a financial assistance program. Virginia Commonwealth University Health System, they have a system. If it's part of a major hospital or healthcare system, you're going to have a financial assistance program. Look into it, use it, speak with your clinical care team if you have lost your insurance or you have questions about how to pay for things. There are resources. Do not be afraid to ask for them or to use them. And I don't have it on this slide, but this is another thing that's particularly relevant to the HD community. If you know that you cannot pay for health insurance or pay for care at this time, it is always important to talk about possibly enrolling in a clinical trial if that is an option if you're eligible, because you can get free care through the clinical trial. The one downside to that, the one thing I don't like about that, is if you are enrolled in a clinical trial, those records cannot be used to get Social Security disability. If you've already gotten Social Security disability and you're on the waiting period to get Medicare, go ahead and enroll in a clinical trial, because it doesn't matter. You already have the medical evidence that you need, get the care that you need. And definitely, like, I'm never saying don't enroll in a clinical trial. Those are really important. Just if you happen to be enrolled in a clinical trial, also try to make sure you see your provider at least once a year outside of the clinical trial to make sure you are building a medical record file. I know we talked about a lot of information today. There are some really great resources that exist and checklists that exist to help walk you through all of this information. It's called the Application Checklist for Health Insurance Marketplace, and it's from the National Health Council. This is an amazing checklist. Why? Because it asks questions about your particular needs. How many doctor's visits do you have each year? How many times a year do you get an urgent care center or emergency room visit? Have you been hospitalized? This checklist is going to help walk you through exactly what kind of care you need. So this is great for you to figure out what level of plan that you need. The getting ready to apply checklist. This is really good if you know what plan type you want and are ready to start the process. This really walks you through what information you need to apply. So basic, like what you need when you're actually going to fill out an application. And I want you guys to be aware of these things. One, because it's a resource I don't have to create because it already exists, but it's really handy to have because it'll walk you through exactly what you need when you're ready to apply for health insurance. So that's all of the information I have to share today. This is the survey Deb was talking about at the beginning. So for everybody who's attended this presentation today, please take the survey afterwards. And for anybody who is listening to this recording, please go ahead and go to this link. Let me know what you think of this presentation. Now we can open the door for questions. And if people don't have questions now, here's my contact information. You're always welcome to reach out to me about this information. I know this was a high-level general overview. It's still important to know all these things when considering health insurance, because unfortunately in this day and age, it has now become each individual's burden to know what they're looking for. There's so much information out there, it's impossible to know what you're looking for, but I really hope this gave you some more information about health insurance today and what to look for when you are looking for a plan.
So Allison, while we're waiting for folks to put their questions in the chat box, I actually do have one for you. Actually, we do have one. It says, does Kaiser Permanente allow patients to stay with their Center of Excellence team?
That's a really specific question that I would have to do research on, because I don't know the facts and figures about every single healthcare system.
Well, I believe that if you're in the Sacramento area and you're in that Kaiser Permanente healthcare system, because Kaiser Permanente Sacramento is a partner with the HDSA Center of Excellence at the University of California, Davis Medical Center, the two actually share staff, and you would be covered at Kaiser for your HD care. You would be consulting with Davis on anything that they needed to with regard to a care plan for you. If you're with a different Kaiser Permanente system in California, I could not answer that question. We'd have to do some research.
No, but that is a good thing to bring up. A lot of times, like let's say the Center of Excellence specialist might not be covered, and it's also somebody you may not see very often because it's really far away. If you can make sure you also create, like you get a local neurologist that's covered by your insurance and they're the ones who's primarily managing everything, that's another way that can help reduce costs. It's okay to make sure you have doctors, like teams of doctors that work in partnership. So you don't see the expensive one very often, but you have one that's covered that kind of manages your day-to-day care. That is an option to think about as well.
I have another question. If you can't remember the exact date you applied for Social Security benefits, is there a record somewhere with that information?
So when you apply for Social Security benefits, really, you can create an online account, and that information should be in the online account. You can also call Social Security directly and ask them.
All right. While we're waiting for a few more questions to come in, can you go over the difference between the health savings account and the flexible spending accounts?
Yeah, so a health savings account is specifically for costs of medical care. So again, that's things like if you have a procedure done, if it's to help cover things that would be considered as part of your deductible. The FSA account, that is for buying things like medication, or not like over-the-counter medication, or over-the-counter products. So it covers things like, my baby girl has a cold recently, I needed child saline solution. That's the kind of stuff that that's covered by an FSA account. So like Tylenol, acetaminophen, I think sometimes even things like, I can't use words right now. A humidifier can be covered. Sunscreen is covered by an FSA. Bug spray, like an FSA account covers like a lot of the over-the-counter stuff that can be used as preventative. Things you might find in a first aid kit, stuff like that. And so the big difference is like FSA is more to cover like your day-to-day, like medical, like small medical care needs, over-the-counter things. An HSA account is more designed to cover bigger medical expenses. So
So is
yeah.
there any expiration? So flexible spending accounts usually have a deadline. You have to use the funds within a specific amount of time, or they refer to the federal government. Is that the same with this health savings account, or does the health savings account kind of roll over to a very specific different set of time?
So there is no deadline for a health savings account. That money stays there forever. And some people, like if they don't, I know people who have used it kind of like as a backup retirement account, like they continue to contribute to it every year, but if they know they don't have a lot of health savings expenses, they don't touch it. That money is there forever. You just have to make sure if you take money out of your health savings accounts that you have a receipt that can back up that it was for a covered medical expense.
Can a health savings account be used to pay for long-term care?
Oh, that's a good question. I don't think so.
Okay.
I'd have to look into that. That's a good question, but I don't think so.
A few other questions that have come in. So my husband's doctor is in another state, which makes insurance really tricky. Any suggestions?
That is really tricky. That is very specific to plan information because I know certain insurance plans may cover a doctor in another state. And so that's something you're really going to have to look into the nitty gritty. Generally, if you want a coverage for a doctor that's in another state, it's likely going to be a plan that costs more money. I know that those plans exist, and I know that does exist as an option. Unfortunately, in a circumstance like that, something like Medicaid may not work. There could be an exception. If you have Medicaid in one state, it will be accepted in another, but that's definitely something where you're going to have to work more directly through the health insurance provider and even the doctor themselves to see if there's a special variance that you can get, a special exception, or what exactly the plan covers.
Going back to the HSAs for a moment, we have a question. Are the funds in the health savings account counted against those on disability because they have to be under $7,000?
I've never had that question come up before because generally if somebody is applying for something like Medicaid or SSI, they've exhausted all other resources first. Yeah, I'm pretty sure an HSA account would be counted against resources and that would have to be paid out. So it doesn't count against things like Medicaid or SSI.
Okay. Would it be possible to ask a question about disability applications, or can you share some links to basic questions about applying for disability?
I don't know. Deb, do you know what the, oh, because we're still, let's see. No. If you have questions about disability, I recommend going to the HDSA disability page, which I should have memorized on the top of my head since it's my program, but I don't. My brain is filled with other important disability facts and figures. There you go. And I don't have, all of the disability chats that I have ever done have been recorded, and those are a really great resource. And I recommend accessing those through the YouTube page, again, because I don't know that off the top of my head. We're going the long way. So this is the HDSA disability page. You can go to disability chats. So you can find a lot of resources here, but I also recommend going to the past disability chats because there's a whole YouTube playlist page for it. And there's a lot of great information here. If you want general information about disability, this is a great place to start. And I go over everything, including completing the online Social Security disability application, preparing to file a disability application, and collecting medical records, and how Social Security evaluates a disability claim and what evidence you need. You're also welcome to contact me for specific disability questions, and we can set up a one-on-one chat.
And that probably is, Allison really is fantastic at helping folks to start down that road for disability and SSDI. So please don't hesitate to reach out to her at her email address or her phone number because we really do value her insights, and she has helped innumerable families to get disability benefits, have helped them through denials and appeals, and really has been instrumental in helping families to get the benefits that they deserve and are entitled to.
Oh, thank you, Deb. Yeah, Social Security disability, that really is my specialty, but I understand now while working with the HD community, that disability really encompasses a lot of things, which is why I gave a presentation on health insurance today, because that's still a component of the whole disability process.
We do have a couple more minutes, so if folks have any other questions, please do put them into the chat feature. I believe we have answered the ones that have come in thus far.
Just so everyone knows, there are a lot of great resource tools that are out there. Like for me, health insurance is not something I know a lot about. This was more of a high-level presentation. The Health Insurance Marketplace website has so much resources and assistance that's really great if you have questions. I know you might have to stay on the phone for a while to talk to a health insurance counselor, but they do have resources and information available to help make it easier. And again, like that's something I can help get you pointed in that direction, because I am not a health insurance specialist. That's a whole different ball game. But if you have general questions, I can definitely help point you in the right direction. And because we're talking about health insurance, I'm going to go ahead and plug this. If you have not done so already, please reach out to your senators and representatives about passing the HD Parity Act, so there is no longer a 2-year waiting period for Medicare. We have information you can find on our website. Does anybody know the direct link to it? Is it like hdsa.org/hdparity?
I think it's Take Action.
Or Take Action.
Advocacy Take Action, right?
Thank you, Matt. I do not know the status of the Parity Act at this time, because that is probably going to get an update tomorrow, but I don't actually know the status of the Parity Act at this time. And just so how it works is Congress doesn't go like Congress's year starts in the fall and goes through the spring. So the Parity Act is still in the same session of Congress. So we're still pushing that forward. It doesn't start over in January. We're still in the same congressional year. Well, if we don't have any more questions, again, please do not hesitate to contact me personally directly. But if there are no more questions about health insurance today, I think we can close the webinar, and please feel free to contact me otherwise.
Well, thank you all very much for joining us today. And as mentioned earlier, this presentation will be available on HDSA's YouTube channel in about a week. And please don't hesitate to Allison with your questions on disability, either by email or her phone number. Thanks so much for joining us today. Ta-ta. Take care.